Here are the two breathing exercises that I use the most for my patients with POTS and PTSD. That's a heat lamp that I forgot to remove from the background. It's not part of the video. So something that's common to all of the diseases in the DAMP cluster that I talked about in the POTS PTSD video is that they can be either excess nitric oxide or deficient nitric oxide. It's not the only signaling gas you have, but it's the main one, and it's behind most kinds of body functions. If you have too much of it, you have problems. If you have too little, you have problems. It needs to be in a Goldilocks zone. Many chronic illnesses are difficult to treat because they can vacillate between the two states. Predominantly when people first come to see me, they are in what we call excess, and so the first exercise I'm going to teach you is going to reduce that excess. This is called the huff and puff. Any kind of medical intervention that you use has a risk associated with it, and breathing exercises are no exception to that. For this one, you should know a few things ahead of time. One, don't do it right after you eat because there's a small chance it'll make you puke. It'd be really uncomfortable. Two, don't do it while operating a motor vehicle. It can make you dizzy and lightheaded. Three, it can cause tetany. There is a whole lot of bullshit on the internet about how to alkalinize your body. That doesn't mean anything. You can't actually do that through diet. You can do it, however, through breathwork, which is what we're going to do today. Tetany is not tetanus. Tetanus is a bacterial infection. Tetany can be caused when your blood becomes too alkaline through breathwork, which is what we're going to do today. The feeling you will have from that is if your hands turn into lobster claws. They just start to lock up. If that happens, it's not dangerous. You can just slow your breathing and recover from it very quickly. But just know, don't do this while driving a car. Also, you can't be afraid of your feelings or anything that might come up out of this. One of the things about PTSD and recovering from PTSD is that your body needs to kind of relive the experience in some ways. And so this is where practices like EMDR, of which I am a fan, can be really helpful if done by a certified or, a really skilled, trained professional. You're going to do this at home, I assume, by yourself, I assume, after watching a hairy guy on social media make a video about it. So just know that it can stir up old feelings. And if you're a PTSD survivor, there's a good chance that some of what comes up, especially the first few times you do this, are not going to be pleasant. So do it in a place you feel safe. And if you need to stop, stop, and know that those feelings will pass. Just slow your breathing, breathe naturally. And here, let me teach you how to do it. Get yourself a pillow, lie down, face up on the pillow. Be comfortable for this. I hope this can still record. So you're going to watch me inhale twice, once through the lower abdomen and once through the chest. And then I breathe out all at once. That's the huff and the puff. You're going to breathe in once through your abdomen. A lot of people can't do this. I tell them to breathe in through their abdomen and they go like that. Nope. This should not go down. This should go up. That's into the abdomen. Then you breathe into the chest. Then you breathe out all at once. You're going to do this for 15 minutes. I'm not kidding. As you like. So I'm not going to do all 15 minutes here. No one will ever watch the whole video, but you get the idea. If you're deconditioned, it can take a little practice to get this to actually work the way that it's supposed to, but do it for 15 minutes, do it for 5 minutes if you can't. Sometimes you fall asleep doing this. That's fine. Again, don't practice it while driving a car. As you can imagine, that is a deeply refreshing exercise, and many people will feel really, really exhausted, but good afterwards. That is what you should do if you are in an excess nitric oxide state. The other one we're going to do today is for deficiency. This is if your nitric oxide is too low. What's a great way to tell that it's too low? You have low blood pressure. Most people with low blood pressure have low nitric oxide. This one is much simpler. It is simply what we call box breathing. This is a modified breath hold. There are stronger versions of this, but this is the one that I feel is safe for social media. So you're going to take a nice deep breath in for a count of 4. Now you're going to hold your breath for a count of 4. Now you're going to breathe out for a count of 4. And now you're going to hold that for a count of 4. Then repeat. That's it. That's the whole thing. You can make it longer than 4 if you want. You can go up to 60. You can go to 100. Do as much as is comfortable for you. If you have low blood pressure, holding your breath longer will tend to raise it by a few points. If you have high blood pressure, doing a lot of deep exhaling, which is what we did in the huff and puff, will reduce it by a few points most of the time. always see a doctor before you start any kind of new exercise program. And this is not the end-all be-all of treatment. This is integrated in my practice with herbal formulas, with nutritional recommendations, with lifestyle practices like going to bed within a half-hour window every night. You'd be shocked at how much sleep hygiene can affect things like dysautonomia. What else would you like to know? Tell me in the comments. Bye, Heat Lamp.